I was beginning to feel hopeless. I'd been feeling depressed for over 4 years at this point in my life. Depression's waking up in the morning and not wanting to face the day. It's a dark cloud that hangs over your head and never goes away. I remember one morning after I got up, made the kids their lunches, sent them off to school. I sat in one of my kitchen chairs and couldn't bring myself to get up. I was there until the kids came home. I was ready to give up at that point. I was ready to die.
What kept you going every day? What treatments did you explore before, and what made you decide to go down the path of ECT therapy?
My kids, my marriage, my family. It's sad, really. The only thing preventing me from the time from killing myself was the thought of my family at my funeral and how depressed they would have become. I didn't want to put them through what I was going through, so I kept pushing. I kept trying new doctors and new ideas that the new doctors had for me. I tried 10 different medications. I tried talk therapy, I tried medication, hobbies, art therapy, anything you could think of, I tried it. It wasn't until I saw my 5th doctor that I learned about ECT therapy.
Were you scared of this treatment? What did you find in your research?
I was scared. I was terrified. I kept watching the videos online of how ECT therapy was depicted in movies in the early 1900s. It made me not wanting to go through it.
Nancy, I know this is your first day, but if you don't give me a hand, I'm gonna let her rip your fucking arm off.
Yes, Miss Reagan.
Don't touch me! What?
I think she's pregnant.
Alice, how far along are you?
I don't know.
You don't know? When is Dr. Frederick back?
On February 3rd, that's 7 days from now.
Great. He could take care of it then.
No, you can't. I'll fucking kill you!
You will do no such thing. What you will do is let this nice young lady put that rubber mouth guard in your mouth and bite down gently.
Miss Reagan, should we...
Now, the moment that you feel your skin burning for the first time, it's just your body giving in to the shock. What a shame it's gonna be to see you chew your own tongue off. Then again, maybe not. Do we understand each other? I really hate to see this pretty little thing in tomorrow's trash.
ECT was used for consequences in the early 1900s. It was used as torture. For most of the time, it was administered under conditions which seemed to us, from our comfortable vantage point, a few generations later, almost barbarous, without anesthetic, muscle relaxant, or privacy. This use for ECT therapy caused it to become known as a form of torture, causing some psychiatrists and psychiatric hospitals to stop using it altogether. ECT therapy is a huge controversy. While no ECT practitioners have been murdered and the rhetoric about ECT may be one notch below that about abortion, the parallels are quite striking. ECT is controversial. Like abortion, a vocal minority of people expend substantial effort to discredit ECT and its practitioners, promulgating a view that ECT is somehow morally wrong and should be banned. But they should look at the positive outcomes of this treatment. Most of the patients who undergo a full set or sets of ECT therapy claim that ECT is the reason why they are still living today.
The reason really is that I am a man who almost 30 years ago had his life saved by 2 long courses of electroshock therapy.
ECT therapy should be considered and used after someone with severe mental illness, including severe depression, schizophrenia, and other mental disorders, have explored at least 2 other options, including medication and talk therapy. ECT isn't the super scary, dangerous procedure that it is made out to be.
I went into the hospital as an inpatient on a Tuesday morning. My husband brought me in, your uncle. I wanted to make it clear how bad I was at this point. I couldn't make my own logical decisions. I couldn't get out of bed in the morning. I couldn't realize what was right in front of me. This was the last option. After the very calm patient doctors and nurses explained to me and my husband what was going on, they brought me into a room with a bed, a machine, and some calming music. I laid in the bed and an anesthesiologist came in and informed me that they were going to put me to sleep and give me a muscle relaxer to modify the seizures that is caused by ECT therapy, so that I wouldn't have a full-blown fit. I don't remember this procedure at all. I woke up with a small headache, and within the weeks following, I had some minor memory loss, including forgetting names for a few minutes, not being able to find the words I wanted to say, or forgetting my keys. This all went away after I was done with the treatment. I went through this procedure 16 times within a period of 3 months. Each treatment worked on another, but I didn't see true results until the 10th treatment.
Plugged me into the wires, put me to sleep, gave me the muscle relaxant. 6 didn't work, 7 didn't work, 8 didn't work. At 9, I noticed, it's wonderful that I could notice anything. I noticed a change, and at 10, I noticed a real change. And he went back to them, and they agreed to do another 10. Again, not a single one of them, I think there are about 7 or 8 of them, thought this would do any good. They thought this was a temporary change. But lo and behold, by 16, by 17, there were demonstrable differences in the way I felt. By 18 and 19, I was sleeping through the night, and by 20, I had the sense, I really had the sense that I could overcome this, that I was now strong enough that by an act of will, I could blow the obsessional thinking away. I could blow the depression away.
What did you notice? How has ECT affected your life thus far? Do you feel as though this was the right choice for you? And do you think this treatment should be used for people in a similar situation as you were in when you got this treatment?
The first thing I noticed is a sense of hope and determination. I felt like I could overcome depression and what I wanted to get up every day and try to work towards happiness. Today, I am a successful radiologist at Rush Hospital in Chicago, Illinois. I have 2 amazing children, an amazing husband, and the best of friends. I have a great life, something that I didn't think was possible a couple of years ago. Don't get me wrong, I have my episodes of sadness and depression like the rest of the human population, but I can honestly say that I'm happy. I strongly think that people with severe mental illness, after trying other options, should consider ECT therapy their best option. It works. One last piece of advice for you college freshmen. Get help if you need it. Don't be afraid to say something if you're feeling down, sad, or upset for a long period of time. Your mental health comes first. Not school, friends, boyfriend, you. Life is amazing, and I hope all of you see it the way I do.